So we're going to give you 60 seconds each to run through yourself, who you are, a little bit about your company and opportunity, and again, maybe your superpower if you want to do that.
Hey everyone, good to meet you. Amir from Ultromics. I'm the Chief Operating Officer for Ultromics. We're a spin out from Oxford University. We spun out around 7 years ago. We're the world's only AI diagnostic in echo imaging. So echocardiogram is ultrasound imaging of the heart. And we built an AI-based diagnostic for heart failure. So heart failure, as many of you probably know, is kind of one of the biggest kind of cost drivers for hospitalization across the US. I think it's almost $50 billion now spent on heart failure hospitalizations. One of the issues in heart failure diagnosis is it's quite easy to see the heart pumping and see how well blood is actually pumping out of the heart. But one of the really complex things to look at is how well is it actually filling up with blood. And this is something that's actually typically very difficult to see from an echocardiogram. And in fact, 64% of patients with this diastolic dysfunction or heart failure with preserved ejection fraction are underdiagnosed. They're actually going home. They're the frequent flyer patients that keep coming back into the hospital and costing the health system a lot of money. So we built a diagnostic that can just take a single apical view of the heart, a 30-second clip, put it through a diagnostic and produce a diagnostic report within minutes. And it's delivered in a cloud-based solution at the hospital. Good to meet you all.
Summarize the key message that you would tell in this very short period of time you have of your clinical and economic value propositions, and make sure you tell us if you're reimbursed or if you're just an enterprise sale that's going to just fit into the overall economics, and explain that business model. So it's really ultimately business model that we're kind of going after here, as well as the benefits.
I think it's fairly easy to convince someone because these patients are the frequent flyer patients. They come to the emergency room, they're short of breath. They often go through an echo workup, an ECG, and they get sent home. They think, well, you're just getting old. Maybe change your diet, maybe exercise a bit more. And they're the frequent flyers. They come back and eventually they're hospitalized. And a heart failure hospitalization costs $20,000 in the US. And for every hospital institution, this is a huge expense. And they don't make money here, they just lose money on these patients. So by using AI, we're able to take the first echo and we identify just off a single apical 4-chamber clip. So we don't need the full echo, we just need a single 30 frames, kind of one heartbeat. And just off that, which makes it very accessible, very usable by anyone, just off that, we can diagnose heart failure. So that lends itself really well to being much more scalable. So the advent of handheld diagnostics, butterfly probes, and people walking around with specific, very small ultrasound machines to find these patients. But on the economic side, it's not just about saving the cost of hospitalizations. We have 2 reimbursement codes for the AI technology. We have both an inpatient NTAP code and a category 3 CPT code. So from a financial standpoint, the provider can actually get paid for doing the diagnostic. They can identify the patient. They can stop them being hospitalized and then get them on treatment to make sure they don't end up in the hospital again and again. So they stop being a frequent flyer. So just purely from the economics, the story makes sense. But just from the patient standpoint, getting them diagnosed earlier in the pathway means they can have much better survivability, lower mortality, much lower chance of repeat hospitalization. So early identification, early in the pathway is the critical piece. And the last piece is ultrasound. There's no radiation, there's no expensive CT scans. It's very scalable, very mobile, which means that it can drive access to care in the community. This can be done in primary care. And that's the future of heart failure detection.